Thrive. Verb. To progress forward despite or because of circumstances into a better future. Is not this what we all dream of and hope for? This life is about more than simple survival. It's about living for a future full of possibilities and opportunities to grow, support our families, and contribute to our communities. For some of us, the opportunity to thrive is taken for granted. We assume each day holds possibilities and that tomorrow will hold even more. We do not fear where our next meal will come from, where we'll lay our heads at night, or how we will access life-saving medications. But for many friends and neighbors, especially during this current pandemic, the dream of thriving feels exactly like that, just a dream. That is why Faith Community Pharmacy exists, to bring this dream back to life, to not just help our clients survive, but to allow them to thrive. Good evening. My name is Aaron Brumall, and I'm the Executive Director of Faith Community Pharmacy. And it's my privilege to welcome you to our 2020 Virtual Celebrate Gala. Now, I would have preferred if all of you were in this beautiful room with me, but as with so many other things this year, that just wasn't possible. But we're going to make the best of it. I hope you have your party pack. I hope you're comfortable, maybe with a couple friends socially distancing, because we have a great evening for you to share with you some of the great things that Faith Community Pharmacy has been able to do and the things we're going to do in the future. You know, we've been around since 2002, and it's hard to believe, but in that time, we have helped more than 7,500 friends and neighbors in Northern Kentucky with over 550,000 prescriptions. The lives that we have been able to change and impact because of your generosity is unbelievable. We have a great evening planned for you. We're going to hear a little bit from myself, our board chair, Nick Farrow, a great partner in Dr. Brian Shack, and a generous client, Tanya Vindler, will share her story and just what Faith Community Pharmacy has meant to her over the years. But before we jump into that, none of this would be possible without our generous sponsors. So I'd like to thank them. First, our platinum sponsor is Blue Star. Our gold sponsor is American Mortgage. Silver sponsors include Humana, St. Elizabeth, Burlington Healthcare, Von Lehman CPA and Advisory, St. Elizabeth Regional Diabetes Clinic, The Drug Shop, HealthWarehouse.com, and Walker Anti-Law. I'd also like to thank our friends of FCP, Total Care Chiropractic, Rural Electric, Roding Insurance, EGC Construction, the Northern Kentucky Pharmacists Association, St. Walburg Monastery, and Novo Nordisk. Thank you again for your generous support. A few things before we get into the interviews. There's a couple more ways that you can help support us. One, our bourbon raffle gets drawn at 7 p.m. this evening. So if you haven't bought one yet, or you want to buy more, go to faithcommunitypharmacy.com/happenings. You can purchase them there. We'll get them entered into the raffle. And then after this video at 7 o'clock, go to Faith Community Pharmacy's Facebook page and we'll do the drawing live. Also, our online auctions are going to be open until Sunday. So I hope you hear amazing things today. I hope that you're so blown away by all the great things that are happening that your heart is just overpoured with generosity and you decide to jump on there and find something great that you can bid on and continue to help this mission move forward. We truly are grateful that you're here. We truly hope and believe that you're going to have a great time. And so without further ado, here's some more about what we're doing at Faith Community Pharmacy. My name is Aaron Brumall. I'm from Fort Thomas, Kentucky, and I'm the Executive Director of Faith Community Pharmacy. I started with Faith Community Pharmacy in December of 2019, and I think what attracted me to it is one, that's a faith-based organization. That was really important to me. I love that we do what we do because we want to be the hands and feet of Christ, to be hands-on, to help people to be healthy and to more than just survive, but to be able to thrive. I think we all know, because we hear it all the time, that prescription prices keep going up. You know, Faith Community Pharmacy is the only charitable pharmacy in Northern Kentucky. If we weren't here for our clients, most of them are rationing their medications or not taking it at all before they get to us. We serve people that are 200% of the federal poverty level or below. Just to give you an idea, our average household has 2 people in it and they make $24,000 a year or less. If you have Medicare Part D, your initial copay can be almost $500. For a family that's making $24,000 a year, that's just out of reach. And that's just people with insurance. That's not the uninsured, whose prices are extraordinary and have nowhere else to go. I think the biggest challenge that we have in the community is that most people don't even know that we exist. You know, I think once people find out that we exist, they can't believe there's somebody that does what we do. And so one of our challenges that we have to overcome is we have to let people know that we're here, so that when people do need help, Faith Community Pharmacy is their first thought of where they need to go. With COVID, we have seen such an increase in need. We are up 30% over last year. As people lost their jobs, as people got furloughed, as people just had money get tight, and they realized they went to that pharmacy and the pharmacist told them how much it was going to cost and they didn't have the money. We were here for them, and we intend on being here for a very long time to help everybody that can't afford their medications. COVID really changed our model, but I think in the end it actually changed our model for the better. It helped us to be even more client-centric. A few things here in Florence, where our home base is we had to stop clients from coming into the building for their safety and for ours. You know, our average client has 3 chronic disease states that are comorbidities for COVID. So the last thing we could do is bring them into a space with other people. So the first thing we did is we set it up that they could pull into our parking lot and call us, and we'd bring the medication out to them. The other major shift that we had to make is that all of our outreach locations shut down. So typically we traveled to Pendleton County and Carroll County and Newport and Covington to make it more convenient for our clients there. But that just wasn't an option. So instead, we created teams of drivers that are going out and are hand delivering medications to our clients. I think what I've learned is that Northern Kentucky comes together when there's a need. You know, whether it be people donating to Horizon Community Funds and how they've supported us during COVID to help ensure that people get medications, whether it be the phone calls we get every day asking if we need medications donated, what people can do to help, or whether it be, I think one of the coolest things is, especially during COVID, we've had a number of clients that we've helped, and then they've been able to go back to work. And so many of them will stop back here on their own time just to say thank you. And I think that just says a lot about the community we live in. I think of one in particular of a mom, actually it was a grandma, and she had just taken in her grandson and he needed mental health medication. They were having a hard time getting him on Medicaid, and as a last-ditch effort she called us, and I took the medication out to her car. It was right at the beginning of COVID, and I could tell she was just whipped. I know that feeling as a parent, and as a grandparent. There was a lot going on, and the child was sitting in the back seat, and it was cool to get to serve in that way. And then it was cool. I love where I get to work because I also asked her how she was doing. She said she was struggling, and I just asked her if I could pray with her. But it was amazing to get to share in that way, and to know that when people are at their most difficult times, we are able to step in usually a very unexpected way to release a huge burden for them. You know, one of the things I've really worked on since December when I got here is partnering with our local healthcare providers, especially St. Elizabeth, Health Point, Humana. What I keep hearing over and over again from most of these providers is that medication adherence is one of the biggest challenges we face in Northern Kentucky, that people just aren't taking their medication. And many of them, they're not taking it because it's not affordable. I think it would be a huge difference, not only for the 1,000 people that we're going to help this year that wouldn't have medication, but but I think it would make a difference for those physicians that are providing health care to know that if they have a client that doesn't have the money, there is somewhere they can send them that is going to work very hard to make sure they're taken care of. I think that's a huge impact and would be a huge loss if we weren't here. I want us to get to a place where no one is scared when they have a chronic disease and they lose their job. I want us to get to a place where nobody in Northern Kentucky is choosing rent or food or medication. That is just completely unacceptable to me. Not only do I want us to get there, we're gonna get there because we have to get there, because people are losing lives. People are losing the ability to work and care for their families. None of that is acceptable, and we're gonna do everything that we can. And I'm so excited about where we're going because there's so many positive changes that we're making to help identify clients that need our help but haven't found their way to our door by working with other nonprofits like the Welcome House and the Brighton Center. We are going to get there, and Northern Kentucky is going to be healthier as a result. Ideally, I hope that somehow everybody gets the medication they need and we're not even needed anymore. That would be a great way for this to end, is that somehow something happens that we're no longer needed because everybody can get their medication. If that's not the case, then, you know, it's not about me, but I'd love to leave a legacy that values every human being, that just because you're poor or impoverished, you're treated with dignity and respect, and where we truly improve the health of our community by ensuring that nobody goes without medications just because they can't afford them.
I'm Nick Farrow. I currently reside in Cincinnati, Ohio, and I am the CFO of Gateway Logistics, Inc. I currently serve as the board chair of Faith Community Pharmacy, and I've been there in that role for approximately 3 years. I've been with the pharmacy for probably about 10 years at this point. I think really the passion that I have for philanthropic causes comes from just the joy that I get from helping people. From an early age, my parents taught me that I should do what I can to help people that are in need. And when I was approached probably about 10 years ago now from my boss at Von Lehman and Company to join a committee for the Faith Community Pharmacy, I was very interested. And then my boss decided to transition off the board. He had some other things going on, so they asked me to join as a treasurer. So I served in that role for about 7 years before I became the board chair. Yeah, my regular involvement with Faith Community Pharmacy is really twofold. The first one is interacting with our executive director, Aaron Broomall, on a fairly consistent basis, just from a high level, just understanding what he needs from the board, what challenges he might be facing in that certain time. And then the second part is really just interacting with the board. Obviously, as the board chair, I'm involved with the executive committee, and their focus is strategy again, but really right now it's board development, creating a strong board that's going to lead this organization into the future. I really think my biggest responsibility with Faith Community Pharmacy is ensuring longevity of the organization. Each of our clients rely on us on a day-to-day basis for their medication, and I want to make sure that, you know, the certainty of getting that medication tomorrow is just as likely as getting that medication in 5 years. I never want to see the pharmacy be put in a position where it's not going to be able to serve our clients. Donor support really is the lifeblood of the organization. It's not the only funding source we have, but is a very large one. I think most people know we as a pharmacy don't charge any of our clients, so we have no revenue stream coming from additional clients we bring on or providing more medications. So the only way that we can expand our reach and expand our impact in the community is by having people that see the value in the pharmacy and are willing to support us going forward into the future. The thing that makes the pharmacy what it is our people. There's no doubt about it. If you come into the pharmacy on a day where there's a pickup, not right now during these COVID times, and you see how people interact with the staff and how the staff interact with our clients, you quickly will realize we're not just providing a service, we're developing relationships, we're making an impact in people's lives that go beyond that prescription that we've just passed across the table. If you read the letters that are written to the pharmacy and you understand just how much we change people's lives, that is what makes the pharmacy what it is. It's the people. It's not necessarily what we do, but it's the people that do it.
I'm Dr. Brian Shack. I'm an internal medicine and pediatrics physician, so primary care basically, and I practice in the Butler office of St. Elizabeth Physicians. I've been here since the year 2000, so 20 years. Doesn't seem like it should have been that long, but it has been. So basically we see everyone from birth to 100 plus in some cases. I actually have one family I take care of 5 different generations of the family. So we provide all services to any ages. I think one of St. Elizabeth's goals, one of our stated goals from Garen Colvin, our CEO, is to make Northern Kentucky one of the healthiest communities in America. And you cannot do that without medication for certain people. So, we would be looking at a very different environment here if the percentage of patients we see who cannot afford their medicine or don't have health care were left out, if they were not able to get what they need. And between the community services that St. Elizabeth provides, the discounts and different things they provide for self-pay patients, and the medications provided by Faith Community Pharmacy, we're able to fill that gap in and take care of everybody regardless of their insurance status, kind of from top to bottom. We are one of the more rural areas in the St. Elizabeth service area, and as a result we have a lot of patients who require extra assistance. And Faith Community Pharmacy is extremely helpful to us because a couple of the big challenges we face are both transportation issues for our patients and affording their medications. So having something like Faith Community Pharmacy that comes to our service area and provides this ability for these people to get medications at no cost is just an amazing benefit for them. They do, of course, have services here in Falmouth, Kentucky, a place that doesn't have a lot of other services. So they come into our community, remove the obstacle of transportation in some ways, and then they remove the obstacle of payment for these medications. So, that helps with these patients who come in and they feel like they have no place to go or nothing to do and no one that will help them because of their limitations, and then you can point to something that's literally right in our backyard that can help them out. A lot of patients don't take care of their medical problems because they can't afford to, and they do ration their medical care because they're worried about some cost problem that they won't be able to afford, so they try to make the medication last. And just knowing that there's a resource that allows them to get their medication and not worry about what it's going to cost next month. Is it going to cut into the food bill? Is it going to cut into the electric bill? Helps that peace of mind, helps them be more compliant with their medical care. And that's just huge because the cost of medication in the United States is, frankly, outrageous, as everyone knows. We pay more than any other industrialized society, and it interferes with basically almost every patient in terms of their ability to afford medication, anybody who's on any medications. So my job would definitely be different if Faith Community Pharmacy didn't exist, and it has not been here for my entire career. As I said, I've practiced since 2000, and for the first couple of years we did not have that option. And in that case we were reliant on samples from the office, or basically substituting whatever medication we could find for a patient, even if it wasn't the best choice, wasn't really what they needed, or patients just going without medication, and so our life would be different because we'd have one less resource to get patients the care that they need. But when I think of Faith Community Pharmacy, I honestly think it's essential. It's an essential service in an area where people cannot always afford the health care they need, and it provides a service that no one else can provide to improve the quality and the health care in our community. So really it's essential to have a program like that in this community. I just want to say thank you to Faith Community Pharmacy for everything they've done. During the time I have been in practice and the time they've been around as an organization, they've been incredibly supportive of my patients and of St. Elizabeth and of the mission in Northern Kentucky. And I don't know everybody at Faith Community Pharmacy personally, but thank you to everyone who makes that happen and makes that work.
My name is Tanya Vendler. I live in Taylor Mill. I love to fish, and I love to cook. 20 19 in March, I came to find out about Faith Community Pharmacy. And the person who turned me on to that was my sister. I was overwhelmed with the thought of, coming to a place that I didn't know anything about. But then when I got here, they all were just so friendly and saying, calm down. We're going to help you as much as we can, and it's going to be okay. Before I actually knew about Faith Community Pharmacy, I was overwhelmed to the point where I just didn't even know if I could go on. It was that bad, especially the cost of the insulin and things. But now, my life is so full and so wonderful knowing that there's a pharmacy out there that truly cares and will do anything to help you. So what a blessing that this has been with all the insulin, and I'm on a pill and I'm on so many units of insulin, and I have colitis, and I have to be put on medicine for that, and a leaky valve in my heart, and it's just, got to be overwhelming, so overwhelming. I just prayed about it, and it's like God led me to my sister, and my sister led me here. And I tell as many people as I know about Faith Community Pharmacy, and they are so loving and so caring and would do anything for you. And so it was like a gift from God. And then once they got all my medicines together, I could not believe how much that it helped me, because it was to the point where we were like, it's either eat or have our medicine. And when they came out with this great big bag of medicine, we just were so grateful. And that's why I tell as many people as I know about Faith Community Pharmacy and how wonderful that they are. They always listen to you and what your needs are. And then they fulfill those needs if they can. And that's what they do here. And it's just such a blessing to know that they really listen to you. Or you could just call them and say, do you have this or do you have that? Is there any way you could get that? And I'm telling you, they will go beyond limits to try to fulfill what you need. And they can do this for you if you just allow them. Don't be scared. They're so easy to talk to, and they'll let you know if they can help you. And 9 times out of 10, they will. They will help you. And like I said, my cost for my insulin and other things was just terrible. And now I don't have to worry about that. And I'm just so grateful to them and what they mean to my husband and me. And they can do the same thing for you. If Chrissy and the other people that work here were sitting right here, right now, I would thank them from the bottom of my heart because of what they have done for my husband and I. Before I met Faith Community Pharmacy, I would rock. I would sit there and rock. My mind would have so many things going through it about how are we going to afford this, how are we going to do this. And then when God led us to them, to you, that just blessed our heart. And I just want to say thank you, Faith Community Pharmacy, for everything that you've done for Dale and me and my family. Thank you so much. And I love you guys.
Every human being has inherent value, a right to health, dignity, and life. We are here for our neighbors in their times of need to provide compassion, hope, and kindness. Thrive, verb. To progress forward despite or because of circumstances into a better future.
That concludes our virtual Celebrate Gala for 2020. We want to take the time to extend our deepest gratitudes and thanks to each and every one of you for joining us this evening, even though we weren't able to do it in person. It's supporters like you that are the backbone of Faith Community Pharmacy. Once again, we want to thank each and every one of our sponsors. Your support during difficult times like these cannot be put into words. We look forward as an organization to serving Northern Kentucky for years to come. And with that, we're going to bring this event to a conclusion, and we look forward to seeing each and every one of you in 2021. Thank you.